I'd like to introduce Dr. Larry Wickerham, lead researcher of the STAR-P2 trial, associate chairman of the National Surgical Adjuvant Breast and Bowel Project, and chief of the section of cancer genetics and prevention at the Allegheny General Hospital in Pittsburgh, Pennsylvania. Thank you for joining us, Dr. Wickerham.
Thank you. Happy to be here.
Today at the AACR 101st Annual Meeting 2010, you presented updated results of the study of Tamoxifen and Raloxifene trial, more commonly known as the STAR-P2 trial. Can you describe the study's findings and its significance?
I'd be happy to. The STAR trial is a breast cancer prevention study that compared two drugs, Tamoxifen and Raloxifene. Both are chemically very similar. We call them selective estrogen receptor modulators, SERMs for short. It's a pill you took it one a day for a 5-year period. And we had close to 20,000 women entered this trial from all over North America. And these were otherwise healthy women who were postmenopausal at increased risk for the future development of breast cancer. That risk was based on family history, mother, sister, or daughter with breast cancer, or other factors in their personal medical history. The results had originally been shown in 2006, and there both Tamoxifen and Raloxifene were equally effective in preventing life-threatening breast cancers. Now, with additional follow-up through almost 7 years, we're able to show that both drugs remain effective in preventing breast cancer and that Raloxifene has fewer life-threatening side effects, which makes it a very reasonable choice for a large number of postmenopausal women, and certainly good news for those that want to reduce their risk.
Great. What makes these results different from those that are previously conducted?
Well, the Raloxifene is now approved by the FDA for breast cancer prevention, as is Tamoxifen now, so that if women wish to consider to take this drug, it'll be covered to whatever extent their insurance covers it. It's relatively inexpensive, and we now know that not only does it work, but it doesn't have many of the life-threatening side effects of Tamoxifen.
And were you surprised by these findings?
We were pleasantly surprised. We hope that the net result will be that more primary care physicians, internists, gynecologists, family practitioners, will begin to use this medication for breast cancer prevention. They already use it widely to help maintain bone density in the spine. The drug is effective in preventing fractures of the vertebral spine, and those women are already getting breast cancer preventative benefits that they may not be aware of.
In 2009, nearly 192,000 new breast cancer cases occurred, with over 40,000 deaths in the United States alone. How may these results of this head-to-head study add to the cancer research arena, or even change practice to help cut these numbers?
Right. I see women in a high-risk clinic every week, and unfortunately, I end up telling a woman from time to time that she has a breast cancer. I'd love for that part of my job to go away. These results are a step in that direction. Breast cancer chemoprevention is in its infancy. These drugs aren't perfect. They don't prevent every breast cancer. They do have potential side effects. But this is an important step in making breast cancer a preventable disease. There's work to be done. There's already work being done. But we hope that women and their physicians will begin to take advantages of what we already know to be an effective choice.
And I'd like you to elaborate on that work. Are you currently conducting any studies to expand on these findings?
When women came into the STAR trial and our prior prevention studies, we allowed them the option of submitting a blood sample when they entered the trial. Over 33,000 women have done that. And we're beginning to look at a molecular profile of those women to better identify who may develop a breast cancer and who may benefit from either Tamoxifen or Raloxifene. We're doing similar profiling on the cancers that occurred in these women so that we can get even more specific on who should be getting what drug.
Thank you so much for joining us today.
Thank you.